from the pattern of the last year. One, focus on relatively small bills. So instead of trying to write the new, really smart, comprehensive 2,000-page bill to replace the failed 4,500 pages, is there a 100-page bill, a 70-page bill, a 130-page bill that could be clearly understood by everybody, where you could have hearings, where you could understand the implications, you could understand what's right and wrong, you could have expert witnesses. Second, do the whole thing out in the open. Make the entire process transparent, from using the Thomas system to file the initial bill so everybody in the country can read it, to having all the markups out in the open, having all of them being open markups, having the bills come to the floor under open rules, and picking up on something the President said as a candidate, and that is having the actual conference bill between the House and Senate on C-SPAN, so that you get into a rhythm of transparency so people can begin to trust the system again. Now, releasing data later on this week on a project with Public Opinion Strategies, which the Center for Health Transformation has undertaken, and the numbers that are coming back is very clear. The American people want the right kind of reforms in smaller bills that are understandable, that are written out in the open. And I think today's report on defensive medicine will resonate with the American people and is an example. So I think you will see a lot of parallel themes if you were to go to healthtransformation.net, where we're doing a daily blog and have been for 4 days now. We've had over 10,000 people participate. And we'll have a live blog, which Andy and I will be part of on Thursday during the actual summit. I think, Rick, you're going to be plugged in. Dr. Siegel, I hope you're going to be also. So we're taking up a series of ideas and laying them out. I think if you're going to take what the center is developing and go through a checklist, you'll find a surprising number of these ideas will be discussed on Thursday. And I really do believe focusing on positive, doable, specific increments, rather than trying to write a comprehensive bill, would be a dramatically better way to go, and one which I think the American people would actually support very strongly.
Okay, may I ask a follow-up?
Sure.
So, as I understand, the Center for Health Transformation is a for-profit consulting firm, and you've met with the House GOP and Senate GOP leaders. You've attended whip sessions to plan strategy, and I know that you've helped write some legislation through your CHT for Nathan Deal, the congressman in Georgia, some of his legislation. I'm just wondering, why aren't you registered as a lobbyist if you're doing a lot of lobbying activities? But if you're meeting with leaders, planning strategy and writing legislation, isn't that?
We don't do any lobbying. What we do is, when we're asked by leaders, we offer them advice at their request when they want it. We don't lobby for. We have a specific part of every one of our contracts that says we will do no lobbying of any kind. No one hires us to do lobbying. What we do is public education, which you're participating in right now.
But when you meet with legislators, isn't that technically lobbying?
It's not lobbying. That's my whole point. Go look at the law.
We're just out of
look, as a citizen, first of all, as a former Speaker of the House, I have an interest in solving problems. We also meet with Democrats on a regular basis. We talk with people. Last year, and it's not very secret. Last year we held press conferences with John Kerry to help on a bipartisan basis pass an electronic prescribing bill, which Dave Merritt was very involved in and Wayne was very involved in. But we do all of it out in the open.
Which is out of the rhythm of transparency that you mentioned. Wouldn't it be good for everyone, all the stakeholders and the public and Congress, to know who's paying your consulting firm when you're doing these meetings?
Everything that we advise people on is published. Everything is out in the open. You can go to healthtransformation.net and you'll see everything we advise people on.
So all your clients and how much they pay you is on the website?
No, because we're a private firm. We don't need, but what I'm telling you is, if you look at everything we have done, if all the advice we offer is published at the center. So any American who wants to know what we stand for, and we tell all of our potential members, we don't change what we're doing because of membership. This is what we believe in. We've been around now for years. We have a very consistent track record. We believe in working on a bipartisan basis to create a collaboration of leaders to transform the health system so people live longer, healthier, more independently at lower cost. And I think our track record on that's very clear, and I think you'll see that everything we do is out in the open.
I just don't understand the distinction, but all right.
No, but we'll be glad to have our attorneys talk to you about it. There's a very clear distinction, and we are very clear that nobody in our organization does any lobbying of any kind.
So you don't advocate a position when you talk to these legislators?
No, we advocate the same position we publish in public. But we don't advocate any position on behalf of any client. We don't go in on behalf of any member and say, let's take care, would you offer Amendment 12? We go in and say, we favor, for example, changes that will end defensive medicine.
And it never benefits your clients?
Only in the sense that it benefits the country at large.